2/3 of the country that are believed to be infected, according to the study from Peking University. Doctor, it's just a mind-boggling number. It's really hard to wrap your brain around it. What do you make of that?
I think this is really astonishing. I mean, when you have a 64% of the country is infected with the COVID-19, and we are expecting there would be around 1 billion trips within next month or at the end of this month, that means that people will be traveling to the rural areas, the areas where elderly people or either unvaccinated or under-vaccinated, and then the healthcare sector is not as good as it would be in the megacity. That means that the overall length of this infection spread would be elongated, and if that remained for a longer period of time, that means the new variants would be emerging and would have a significant constraint onto the rural population. Although we don't really have exact information about the total number of infection as well as total mortality, but ultimately is going to yield quite heavy impact onto the population.
China is no longer providing daily COVID statistics. How critical is it for Beijing to be transparent with its COVID data?
I think for every country it's absolutely critical to share honest and transparent information, because if we don't really know how much is the impact of a certain infection in a country, we cannot envisage what would it entail for other countries. And that is primarily the reason that majority of the countries in the world, including Europe, since they are not getting a transparent information, they are generating their own data by screening people and identifying the positive cases and then sequencing those cases to identify if there is a new variant or any potential variant that could evade the immunity into the global population. So certainly it would raise a lot of concerns, a lot of questions, because not having a data enough, you cannot really gauge the true impact of this infection in any country.
The government officials, though, they say that many provinces have passed the peak of infections. What's your feeling? Can we trust that? Can we expect that cases will start to drop in those areas where the government claims that the peak has already passed?
Maybe in the mega cities where the infection has started a little bit earlier and people started moving as soon as the zero COVID policy was abandoned over there, maybe the peak has reached, but that peak probably be very temporary, because when the infection would spread into the rural area, the overall infection in the country will remain high, and people will then be coming back to their normal work after the lunar years. They're going to spark back into the infection people. And we also know that the immunity caused by the natural infection is a very short-lived. So we cannot say that, okay, 64% of the population is infected now, and that would build up the immunity to protect the country for the rest of the year. That's not going to be the case.
All right, Dr. Munir joining us from Lancaster. Thank you.
Thanks for having me.